Now we're going to move into auriculotherapy, just introducing it, and then we're going to do the video if that works for everybody, and then we'll do our live ear seed model to end. So ear seed therapy, we just launched our ear seed clinic at the Cushman Wellness Center, and we can treat whatever ails you, be it insomnia, be it pain, immune system boosting, you name it. The ear represents a whole map of the body, just like reflexology, foot and hand reflexology. It's if you look at the ear, it's an upside down fetus. So that's how that represents. The head would be here, the baby. The spinal column wraps around here, so we can treat all types of back pain. And then you've got your internal organ system. So a lot of times, like if I'm doing weight loss, I'm treating the spleen and the stomach on the patient because we want to support those organ systems. And then here we've got the tail. So a lot of times, in fact, I just did this the other day. I ear seeded the heel and it was ankle, knee. I think it was the heel and the knee. I get so many. One patient comes with like a whole list of complaints. But just know we can treat whatever ails you on the ear, and we can do that with the ear seeds and with acupuncture during the treatment. So pretty cool stuff. And with the ear seeds that we're using now for our ear seed clinic, you can come in and get just a quick 15-minute treatment, or you can come in and get an acupuncture treatment, follow up with an ear seed application. So just know it's about a 15-minute appointment. We've got our traditional standard ear seeds. These have little herb pellets on the back. These particular herbs stimulate, so they're going to help to circulate and move as a treatment function that particular area. So these are really good for pain because we want to circulate, remember? And then if you don't want to bling out, sometimes, these are really great man-looking ones. Not all men want to be wearing crystal bling ear seeds. So great male accessory there. And then we've got our bling ear seeds that we offer in the clinic now, which are both clear and we've got the chakra colored crystal ones. So you can mix and match when you come see me. You can just do clear, but I do have to tell you, crystal's pretty popular. You can wear these like accessories, like earrings, and they work really, they're mask friendly these days. I've lost so many earrings wearing regular earrings, so I just wear my ears. Well, actually, I have earrings today for the presentation. Normally, I don't have hoops on, but I've got the bling ear seed up here, I think. I might have taken them off. You want to take your seeds off every week and put it on a fresh round. Okay, so and then just know there's a couple different terms for ear seed application: auriculotherapy, and it's also known as ear seed acupressure and auricular acupressure. So if you hear any of those terms, they're all the same thing. And I wanted to show one more thing. The needles, because people are always like, does it hurt? Whenever you ask a question. So if you all want to just pass around a needle, I know a lot of you have seen a needle, but they are here fine. I don't know how well this will show up on video. People see that? No. Oh, okay. Well, just trust me. Just look at your piece of one of your hairs, and that's how big the needle is. And usually for facial rejuvenation, like I'll use a very thin needle to stimulate blood flow and chi flow, as opposed to if I was treating a musculoskeletal condition, and it also depends on your patient, their thickness of the patient. We're going to use a thicker needle, but again, it's all supposed to be comfortable. The effects of acupuncture that are good is warm, dispersing, achy, and dull. Means that's great for moving and activating the chi and blood flow. Sharp and shooting is not. So please have that as a takeaway. If you have acupuncture, sharp and shooting, no, say something. Warm, dispersing, aching, and dull, and you're comfortable, you're on target there. So now we're ready to do our live video, and we're doing one on the upper back, neck, and shoulder. And then if we have time, we'll be doing a live Earseed model, which won't take very long.
Everyone, Dr. Foster here with Design to Heal at the clinic, and today I'm treating a neck and shoulder patient. She's already got some of the needles in, she's cooking, and I'm going to go ahead and apply some more electrical stimulation to the areas to help relax the muscles. Contracted spasm muscles work really well with the TENS unit, transcutaneous electrical stimulation, to help calm and relax the muscles. It's actually working the muscle out to put it into a fatigue state so it's no longer tight and creating pain and impingement on nerves. So I'm going to go ahead and attach that, and then we'll do a little bit more other therapies to show you the neck and shoulder treatment. So she's got pain along the neck, shoulder, and the mid-scapular areas, right next to the shoulder blades. And we just want a nice, comfortable tapping with the electrical stimulation. More is not better in this treatment. I think it can actually cause more inflammation if you have it too high. So everything I do, I want the patient to be comfortable and relaxed. We're going to go ahead and turn this lower one on. Tell me when it's comfortable. Good, good. Okay. And here we go. Maybe a little lower. Here we go with the upstairs one, right up here on the neck, or the shoulder and upper back area. That's good. Are those both comfortable? Yes. Okay, great. Now I've also got the infrared heat lamp over top here, which is really great for all types of conditions, especially pain, all types of back pain, sciatic pain, knee pain. And then it's also really great for skin conditions and detoxifying the body. If you had a patient that was going through chemotherapy to help move out the toxins. And then next in the treatment, I use moxibustion therapy. This is to be using an indirect heating method. This is like a charcoal stick. It's a smokeless moxibustion treatment. Really good for patients that have sensitivities to smoke. And I'm going to hover that right over the area to help dispel the cold from the muscle tissues and joints. So it's going to be very warming. And then it's also going to help to decrease pain, great for sports injuries, traumas. And it goes at a real nice deep level when it's going right over the acupuncture needle. How does that feel? It should give a nice warm dispersing feeling and kind of a sedating effect. Now I usually do this for about 5 minutes, unless I'm doing multiple areas, then I'll go to all the different areas that I'm treating. Sometimes I have patients that come in with 6 different ailments, so I usually tell them to pick their top 3, and that's
Seed application. Do you need me to move it on? Okay. All right, so we're gonna do our ear seed application, and Suze a lucky gal. She gets a couple of the crystal ones, and these are Swarovski crystal ear seeds, and they have the instead of the earth pellet, they have a 24 karat gold pellet. So the gold is going to be very tonifying. Now, if you ever see a silver pellet, that's very sedating. And then I already told you what the little herb pellet was good for. So we're going to do one of each kind. And for her, we're going to be treating some spinal, can I tell them? Okay, some HIPAA, some spinal stenosis. And this is in her low back region. And then, as I explained earlier, I always treat also the mental health component of the patient, because whatever's going on by mentally is affecting us biologically. So we want to make sure that we're getting body, mind, and spirit to create that balance. So I think we'll put the fun ones on first, the crystal ear seeds, and she's going to get the lovely clear crystal ones. And the ear seeds can stay on up to a week. And then you'd either follow back up with me in the clinic, and I would do a new round for whatever condition you want to focus on. Or if you aren't able to come back in a week, then you would be taking them off like a little Band-Aid, just peel them off. You would be stimulating them. I give you post-care instructions or after-care instructions on what to do with them. And then you're welcome to always reach out to me if you have questions or need guidance around them. But you can stimulate these pellets as often as you need to. So say if I'm treating if she's got her low back pain, really like at a severe level, then we're going to have her stimulating those frequently. I mean, I've had some patients stimulate them 100 times, throughout the day. Some people might do it 5 times. Either way, the point is still being stimulated, even if you're not touching it. So that one's a good calming the mind point that I did. Now let's move over to a traditional one. And I'm going to use this one for the low back pain area. And these are also nice if you don't want to be blingy, you don't want people to see them. The more flesh color ones will work nicer for you. But you can actually look at her ear and see some redness and swelling. So I can do ear reading, and she didn't have to tell me she has back pain. She actually has mid back pain too. I don't know if you know that. But she's got inflammation along the mid back area as well. Did you know that?
I did not.
Okay.
But when you put in the second ear seed, the calming, was that
On that side?
Yes, all of a sudden my whole body just felt very calm. I don't know if it can happen that quickly.
It can happen that quickly. So she got a feeling of calm right when the ear seed went on. And that's how effective these can be. Some people may not feel anything. Again, remember the subtle, some people feel energy, some people don't. So some people are more in tune to energy, and Suze is an energy worker. So she probably felt it, like she said, right off the bat. So that's pretty cool. And I, see it in the patient's eyes when they're leaving, just like acupuncture. They look very calm, very serene, and they get to wear those, have their medical treatment for up to a week. Now, if they fall off before that, that's okay. They just want to make sure that they get the little ear seed pellet so it's not falling into the ear. So that's what I'm telling my patients when I see them. If you don't see me and you're taking the ear seed off, make sure that you're getting the ear seed pellet, because sometimes it'll stick on the ear. But here's a up and close shot. That. And here's the 24 karat gold pellet. And Suze is now ready to hit the town. TGI Friday. So a couple ways, a few just little techniques. Is 4 techniques, which I do have on my instruction sheet. I'll just go over and then we'll be ending the talk. If anybody has any questions, we'll open it up to questions, Q&A, and then I'll let you be free in TGI Friday. But the sandwiching technique is the finger front and back. So we're just holding on the pellet, the ear seed there, and stimulating it. We could also just do a push and hold, she will, because I won't be here. I won't be walking around doing it for her. But she will do a press and hold, or her partner could do it for her. Press and hold to stimulate. And then we can also do a tapping. So let's tap the low back area. We can do a tapping technique on the ear seed pellets. And then we can also, one that I like to do on mine frequently, because I usually have mine on every day, is a circular massage. So I'm kind of pushing and holding gently. I'm not embedding the pellet in my ear. And then I'm just doing a nice circular massage. You getting more relaxed, Suze?
Yes.
So thank you for being my model.
Thank
She's
you.
so warm.
Great.
So if anybody has questions, we're opening the floor to questions. Ask away. What? You want me to say? Back over to Cody. All right, I'm gonna hydrate. I tell all you guys to do.
Okay, we have a question. What do you recommend as the most efficient treatment for insomnia?
Oh, okay. So what, if I'm understanding, is this relating to acupuncture, or they're just for all treatment modalities that I've discussed? What would be great for insomnia? Okay, overall. So I'd have to say all the above. All the above, and it's just a matter of preference. Choose what you enjoy and what you like, and experience one. See how, again, acupuncture for insomnia though is going to be a building block effect. So you've got to give it some time. If you're just doing acupuncture, you would want to be doing that a series of weeks. Ear seeds would be another nice combination along with the acupuncture, because then you'd have that treatment therapy going every day. I'm also recommending regular massages to all my patients, even if it's just a once a month. That can be very calming. And it's nice if you can get your treatments at the end of the day, because I have a lot of my patients that are able to then just go home, and they always tell me, I slept so great, so it's nice, and not have to go back to work.
Another question here. One of the attendants has a new lens, and the right eye is still having blurriness. Can acupuncture improve one blurry eye?
Are they talking about a contact lens?
You didn't specify.
Well, overall, I mean, we can help to.
Eyeglass.
So, can you repeat the question
Yes.
one more time?
With new eyeglasses, the right eye still has some blurriness.
Mm-hmm.
Can acupuncture improve blurriness in that eye?
Yes. Okay. So first, I'd want to make sure that you go back to your doctor. Make sure you have the right lenses first. So you're good there. That's not creating any blurry issue. Acupuncture can be fortifying for the eyes. So can Chrysanthemum Tea. You can go to your Chinese market, pick up some Chrysanthemum Tea, really great for the eyes. So there's many just, herbal foods and things that I can recommend for food therapy, Chinese herbal-wise, that's going to help boost the health of the eye. Also diet, getting in your carrots. You could do a lot of raw carrot juicing. So many things that we can do. And in Chinese medicine, we do look at the patient nutritionally and lifestyle. So yes, to answer that question.
Hope that answered that for you. Did that help? Any other questions?
So far,
Okay.
if we have no other questions.
Anybody in the audience?
So in between acupuncture treatments, are there points on the body, like here between the thumb and the index finger, somewhere that you can touch or put pressure on yourself that also helps?
Absolutely. So we have somebody in the audience that asked about using acupressure in between acupuncture treatments, and that's definitely something that we can teach a patient. This is a very common one. She pointed this one out for pain. So pain anywhere on the body. You could be just doing a nice applying of pressure, which would be an acupressure. Sometimes it's a really good one for headache pain, but all over pain, this is a good one. And then you've got this one would be a nice one to share with summer coming. And I've had to use it a lot because I'm not a boat person and I get motion sickness. And this is a great anti-nausea motion sickness one. Yep. So on the wrist, a couple inches up, apply pressure. But yes, you can definitely use acupressure and get with your practitioner, and they can teach you depending on what protocols and points you want to learn, and they can give that to you. And then you could also have your ear seeds helping you along the way as well. Do you have any questions out there in the audience? Any more? Okay, well, I think we're done with Q&A. So I want to thank everybody for your time. Thank you for participating. Please reach out to me anytime that you need me, Dr. Michelle. You can reach me direct at the Cushman Wellness Center for any of these type of appointments. If you have loved ones in the hospital, all they need is a doctor's order. We can come over, do a massage. We can provide acupuncture therapy at the bedside. They can get a double, which a lot of my patients do, which is acupuncture followed by a massage. So just know that we can also support in the hospital as well. And these are the main phone numbers for scheduling appointments. You can always call the secondary acupuncture number direct. If you're not getting the assistance you need, leave a message and we will call you back. We do take some private insurances. It's all dependent on your plan. So our front office will verify that and see if your plan qualifies for here at the Cushman Wellness Center. Otherwise, we've got our cash pricing and we've added the 6-packs now. So you can get a 10% discount on all the massage services and the acupuncture services. So TGI Friday, happy Friday, everybody. I hope you all enjoyed. And it's been an honor to present today. Thank you. Oh, and then also there are some studies and references that I've added to the talk. So please reach out and look those over. They're very interesting ones, and some of them touch on chronic pain. And another one is on prevention of lifestyle disease. So again, maintaining your health. And then auricular, the ear acupuncture to relieve anxiety and stress. That study was related to healthcare workers, which definitely they all need that love and support. So we are here to the public for service. We're here for the staff for service. So please come and see us, and we'll be here waiting for you. Thank you so much. Namaste.
Thank you so much, Michelle.
Thank you.